All right. Good afternoon, everyone. It is great to have you with us on this Thursday, June 17th. Let's get the briefing started. On our panel today, we have Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Director of Medical Services for the Milwaukee County Office of Emergency Management. Commissioner Kirsten Johnson, Commissioner of Health with the City of Milwaukee Health Department. Darren Roush, Director of the City of Greenfield Health Department, and Peggy Williams-Smith, President and CEO of Visit Milwaukee. Dr. Weston, let's hand things over to you.
All right, thank you, Kimberly. Good afternoon. As our new Thursday format, I'll be providing a brief summary of our trends, and we'll stay on and be available for questions as well. So we're currently seeing in Milwaukee County an average of 20 new cases a day, and we're seeing about 1 death every 2 days. We're at 1.4% positivity. That's a new low for Milwaukee County. And we have 32 patients currently hospitalized with COVID. We are seeing stability in individuals seeking out vaccines at just over 1,000 people per day on average now. That's actually slightly higher than what we were seeing a week ago, which is certainly encouraging. We vaccinated 46% of our total county population and 36% of our high and moderate high vulnerability communities. So with that, I will pause and I'll hand it to Commissioner Johnson. Thank you very much.
Thank you, Dr. Weston. I want to start by sharing the updated gating metrics for the City of Milwaukee. This week, our burden rate is 18.6 per 100,000 people. This is only a slight decrease from 18.8 last week and remains in the moderate transmission category. Our test positivity is 1.5%, also a slight decrease from 1.8% last week, and remains in the low transmission category. Our numbers have leveled off after the exponential decline of the last month. On Tuesday, there were some questions about the Delta variant and its prevalence in Wisconsin and Milwaukee, as it has been named a variant of concern by the CDC. A variant of concern designation is given to strains of the COVID-19 virus that are believed to be more transmissible or that can cause more severe disease. To date, there have been 26 confirmed cases of the Delta variant in Wisconsin, but only 2 in Milwaukee County. Both of these cases were identified at the end of May. As a variant of concern, we continue to keep a close eye on it, but the fact remains that it's the same for this variant as with every other. If you get your vaccine and get both doses of the 2-dose vaccine, you will be protected. Recent studies show that 2 doses of the Pfizer vaccine are 96% effective against hospitalizations from the Delta variant. Currently, 51.5% of Milwaukee adults have received at least their first dose, and 45.5% are fully vaccinated. We continue to see increases in these numbers, but our work isn't done. The vaccines is effective in protecting people from all variants of COVID-19, and our goal at the health department has always been to protect the health and safety of our residents. This is an all hands on deck effort. Even if you're already fully vaccinated, talk to your friends, your family members, neighbors, and coworkers. Answer questions if you can, or direct them to resources like milwaukee.gov/COVIDvax. Offer to go with them to a vaccination site. And we have great opportunities coming up, including tonight's clinic in the Deer District. We will be at the southwest corner of the Fiserv Forum Plaza from 5 until 7 p.m. with vaccine. Everyone who receives their vaccine will be entered to win 2 free tickets to Game 6 tonight. This is for people who have not yet been vaccinated, so no, you cannot get a booster shot because we keep getting that question. These are great seats, section 101, 12th row behind the basket. You can't ask for a better way to experience tonight's Bucks win, we hope, and we'll be drawing the lucky winner tonight at 7 p.m. Last week, we vaccinated 17 people before Game 3, so there was a 1 in 17 chance of winning those tickets. Our priority is to get as many people vaccinated in those 2 hours as possible, but you can't beat those odds to catch a playoff game for free. This weekend, we have mobile vaccination clinics throughout the city. Tomorrow, we'll be at the Washington Park Library from 12 to 4 p.m. Then we're back at Hellfair Field from 3 to 7 p.m. So those who got their first doses before the Brewers games on May 26th and 27th can get their second dose. On Saturday, we'll be at the Walker's Point Community Clinic at 130 West Bruce Street from 9 a.m. until noon, and St. Roman's School at 1810 West Boulevard Avenue from 2 to 4 p.m. On Sunday, we'll be outside the Voces de la Frontera offices at 1027 South 5th Street from 9 to 11 a.m. during the kickoff event for their mass march to Madison. We are also partnering with the Milwaukee Community Kickball League to bring vaccines to an event at James Beckham Park located at 900 West Brown Street from 2 until 4 p.m. There will be food, games, music, and of course, free vaccine. Finally, a reminder that City Hall and other City of Milwaukee buildings will reopen to the public on Monday, June 21st. Visitors to city buildings, regardless of their vaccination status, will be required to wear masks in these spaces. Similarly, city employees will be masked when they are in public areas. Thank you. With that, I'll hand it over to Darren Rausch.
Thanks, Kirsten. It's my pleasure to join today to provide a data update on what COVID's looking like at this point. And before I start, let me talk about 3 overall takeaways in the data. And you've heard this mentioned by both Dr. Weston and Commissioner Johnson. Cases continue to decrease overall, and we're seeing the lowest case numbers that we've seen throughout the pandemic. And that's very, very good news. Secondly, we still see disparities by race and ethnicity, and I'll walk through the data a little bit more closely today to point out those disparities in cases. And those disparities also continue in the vaccination data. And unfortunately, we don't have vaccination data available, but we still see similar trends in that data. And when the vaccination report is complete, I'll be happy to share it with Kimberly to share out with all media as well. Lastly, as Commissioner Johnson mentioned, the variants of concern are being closely monitored. We are at all levels of public health closely monitoring that Delta variant. And while the numbers are low in Wisconsin, we know they're not low in other parts of the country. I have heard and seen reports of as many as 10% of the new cases being the Delta variant. So this is something that's very concerning and that we will continue to watch and track very closely at all levels. So with that, let me go ahead and share the data, and we'll start with the kids report today and walk through some of the key issues that we've seen with kids. Again, as I've said, cases are down. So you can see here that the number of confirmed cases over the last 2 weeks in Milwaukee County is only 14 cases, and all of those were from the city of Milwaukee and 0 in the suburbs. So again, we're seeing very low case numbers. One of those 14 cases was hospitalized. The kids data shows a plateau over the last few weeks, as we see here, basically a flattening of data over the last couple weeks. So there's still cases, and I would say the majority of our cases in kids are coming from the city of Milwaukee. And so certainly we're seeing much less activity in the suburbs over the last few weeks. And again, some of that is to be expected with lower testing more recently as well. The demographic patterns in kids mirror what we're seeing in the whole county. The recent increases that we've seen in kids has primarily been driven by kids that are in their teenage years. So primarily we're seeing kids in the 15 to 17 year age range driving those cases. And you see that here on this graph. The biggest increase of cases really starting in November and continuing was in that 15 to 17-year-old age group, obviously an age group that is more mobile than some of the younger ages. But certainly you can see that we have seen increases in all of these age groups. And certainly since about April, we've seen a bigger increase in those age groups, most likely because those age groups were not eligible for vaccine until more recently. And yet again, kids under 12 are currently not eligible for vaccine, but we certainly hope that in the fall or late summer, the vaccine will be eligible, or they will be eligible for that vaccine. Lastly, I'll show the hospitalization report for kids. And again, this trend mirrors what we saw in the whole population, but again, showing here and showing this data to demonstrate that yes, there are, on average, 1 to 2 children a week over the last month or so that have been hospitalized due to COVID. So COVID still remains very serious for those who get infected. So shifting gears now to talk about the whole county report, we saw 14 cases amongst kids 18 years of age and younger. In the total population, we had 98 cases in Milwaukee County last week. Of those, 79 in the city of Milwaukee and 19 in the suburbs. And we reflected about 42 hospitalizations and 2 deaths. So again, those numbers have been some of the lowest we've seen, but still for those 98 individuals, COVID was significant and it caused significant disease, and we certainly saw deaths and hospitalizations. When we look at the numbers of new cases, again, we can see how we have tracked throughout the pandemic, our peak back in November, And here we are at very, very low numbers with very, very low percentage positive. And that's very good news. Our deaths continue very low. You know, as I said, we had 2 in the last week, but there are many days here where we're not reporting deaths. So I think that's really due to high rates of vaccination in our most vulnerable populations. Our transmission rate, our reproductive number, has been largely below 1 for a long time. I've said this, you know, starting back in April, we started moving down. That transmission rate was low, but recently we have went above 1 again. And that means we're having more cases than, more secondary cases from each individual new case. So that's something that we want to see squelched a little bit and pushed down. The patterns that we're seeing in the city of Milwaukee look very similar to the suburbs. We see a transmission rate of 1.03 in the city. When we look at the suburban communities, the pattern is the same, but the number is higher, where that transmission rate is much more significant, approaching 1.3, 1.35. So something we want to watch very carefully. The demographic patterns has really been something we've been watching quite closely. And here I just want to show what we've been talking about over the last couple months. We continue to see disparities by race and ethnicity, and specifically we have seen a marked increase in African American population cases really since the first part of April. So you can see that white population has the most cases overall in Milwaukee County. Next is the Hispanic Latinx line here in the green. And this Black or African American line has increased pretty significantly since April and is very close to being similar in overall cases to the Hispanic Latinx population. Now, while the cumulative cases are very similar amongst those two populations, it's important to remember that when we look at incidence rates in those populations by race and ethnicity, Hispanic and Latinx remains the top most impacted race and ethnicity group for COVID-19 at almost a factor of 2 or a little over 2 compared to any other group. So that is of concern, and that's something we've been tracking for most of the past year, is really high rates of disease in the minority populations. Next, let's talk about testing. Testing has been down the last 3 weeks. Certainly testing is a little bit impacted by cases in the community, but certainly we know testing is a great way for people to find out if they're infected. And so I reflect here that data for this week, while still pending, is about half of what it was last week. And we certainly see a drop off since about the last part of May. So there still is a lot of testing capacity, and certainly those low numbers of testing certainly impact the significance and the consistency of some of these rates and percentages. So you see, because some of this data is still pending, we see a little bit of more fluctuation in the data than we have overall, but generally those trends have been very flat over the last couple weeks. Lastly, I want to talk about the spatial maps and show you where disease is occurring throughout Milwaukee County. And just as a matter of reference, let me compare the totality of the pandemic on this spatial graph. This is showing the rate of new cases of COVID-19 in our community from March 6th of 2020 through earlier this week on June 15th. And what I want to point out here is these are the areas in red and orange are the areas with higher activity, but you can see on the scale, the areas in red and orange are in the hundreds. And certainly over the totality of the pandemic with tens of thousands of cases, this is where we are. But when we look at the more recent week, these numbers are significantly lower. We see certainly orders of magnitude less. We're seeing 0.3 to 0.9 cases in these census tract areas. But while the numbers are low, I want to continue to stress that COVID is out there and COVID can be infectious and can be a concern, especially in those who are unvaccinated. So what we continue to see, and this is a trend that we've seen over the last several weeks, the areas where COVID is still occurring is primarily in areas in the city of Milwaukee, the northwest side, some of the northern suburbs, and even some of the areas of West Allis, West Milwaukee. But these are largely areas that we have noted in the past that have had high proportions of racial and ethnic minorities, limited access to health care. More recently, we've noted that these are areas that have lower vaccination rates. So certainly there still is a risk of disease, and it's magnified in some of these communities and some of these areas because of low vaccination levels. And it really points out the need for continued outreach, continued education, and continued targeting of vaccination efforts to these areas. And as I mentioned earlier, unfortunately, we don't have a vaccination report this week because of a data issue with the data coming from the Wisconsin Department of Health Services. We're going to plan to put together that report, and I'll disseminate it out when we receive it. Commissioner Johnson talked about the data in Milwaukee County. Certainly those numbers continue to climb a little bit every week. We're trailing, statewide percentages for both first dose and completed series by about 2%. But certainly we're all trending upward very, very slowly, and that's certainly a positive. We certainly want to get those numbers higher. And to echo Commissioner Johnson in my final comment today, I just want to continue to stress the importance for everyone out there to be a champion for vaccination. Your personal story may be the motivator for others. So be sure to tell your story. Be sure to reach out and connect people with where they can get vaccinated. And there's many great opportunities throughout Milwaukee and Milwaukee County in the coming days and weeks. So thank you very much for your time and attention. I'll now turn the briefing over to Peggy Williams-Smith.
Thank you very much. Thank you for having me today. First, I wanted to start by thanking the elected officials and Commissioner Johnson for relaxing COVID restrictions when the CDC announced it was safe to do so if you've been vaccinated. This enabled many of our hospitality businesses to move forward with tentative events. It allowed families to move ahead with reunions and weddings, and it lessened the burden on our frontline staffers to enforce laws and mask mandates. In fact, this week's STAR report, which is the measure of how well our hotel community is doing and the measure of hotel occupancy, we saw nearly 50% occupancy for the first time since March of 2020. So the improvements that we're seeing week over week and the continued growth since moving out of phase 6 of moving Milwaukee forward, which was the health department's COVID safety plan, has really helped some of our businesses start to be able to get back to some semblance of normalcy. Secondly, I'd like to thank Commissioner Johnson for her willingness to work with business and organizations like Visit Milwaukee during this entire process. As I spoke with my colleagues around the country, our public-private partnership was something that wasn't happening everywhere, and I really do believe that it helped some of our businesses to survive during the pandemic. We have been thrilled to see that because of Wisconsin's successful vaccination program and common sense public health guidelines, that many events will still be able to happen later this summer. We've got Summerfest, State Fair, Mexican Fiesta, and Irish Fest, to name a few, as well as Harley-Davidson's recently announced Hometown Rally. These events will provide a badly needed boost to our hospitality economy through guest rooms, restaurants, bars, shops, you name it, everything that touches the hospitality ecosystem. And as I stated, we are already starting to see signs of a recovery. In March and April, in part, thanks to the hard work and cooperation from the health department, some of our youth sports events were allowed to take place at the Wisconsin Center and other venues in the area. And while these were only a handful of events that took place throughout March and early April, they brought over 35,000 attendees to town and roughly $8 million in economic impact to our community. And we expect to see youth sports events like these continue. Leisure travel is definitely leading the way to recovery, just as we anticipated it would. And I'd like to share some statistics with you. The number of American travelers with plans to do so in the next 6 months is holding steady at 87%. 52% of American travelers say that the vaccination rate in a specific city or state will either have some influence or strongly influence their destination choice for travel. That is incredibly important, and that is why a lot of our focus with our partners is on making sure that people are educated about getting vaccinated. American resident sentiment towards travel is continuing to improve at pandemic high levels, with 67% now ready to welcome visitors back into their community. And that's up 12 points in the last 2 months alone. 70% feel safe to travel outside their own community, and that's up 11%. And 71% feel safe dining and shopping locally, which again is up 10% during that same period. Our marketing and communications team are hard at work on our campaigns, and we have seen an uptick in travel writers coming to our city to write about the magic they find while visiting. We're also seeing renewed confidence from meeting planners. In May, our sales team booked 21,000 room nights for future years, which is a great number even pre-pandemic. To give you an example, in 2019, we booked a little under 10,000 rooms in that same time frame. And we're also continuing to see lead growth month over month. As a matter of fact, group bookings for 2022 are on pace to beat 2019 numbers, which is a fantastic place to be mid-year. And we also have about 58,000 room nights booked for meetings and conventions throughout the end of the year, with events like USA Triathlon in August, and of course, the Ryder Cup in September. And one of the most exciting things for us is the Wisconsin Center expansion. This will allow us to move up a tier for meeting planners who require more square footage, and it'll also allow us to book simultaneous groups at once. All great things for the tourism economy in our region. The anticipated completion could not be better timed, 2024, which is when convention travel is expected to resume to normal levels, which will coincide nicely with our expansion's completion. For groups coming this year and booking into the future, they are so happy that the Wisconsin Center was an early adopter of stringent safety protocols, and it was the largest convention center in the state to earn the coveted GBAC accreditation. And we believe that it will continue to attract planners who are ready to meet again. My team and myself have already attended 4 trade shows, and we have found that people traveling for meetings and conventions tend to have higher vaccination rates than the general population, which is yet another reason why we're encouraging vaccines. With all of this said, we are, again, still a vocal advocate for vaccine adoption. I firmly believe it will be vaccines that help get us from this point to a full recovery, as locals and visitors alike will feel more comfortable patronizing Milwaukee's hospitality businesses. Like I said earlier, locally we've supported community-wide vaccine campaigns spearheaded by Healthy MKE, the Medical College of Wisconsin. We hosted a hospitality vaccination day at the Wisconsin Center to encourage hospitality employees to get the shot. And we recently hosted a vaccine drive at Holy Redeemer Church on Milwaukee's North Side. Like the leaders here today, we know that adoption of the vaccines and taking precautions if you're unvaccinated are the only ways to keep the local restrictions where they are. And we are doing all we can to spread that message to the local hospitality community. Thank you so much for having me here today. And if you have any questions, I welcome a conversation anytime.
Peggy, thank you. Our first question is from Joyce Garbasiak with WISN 12. And this question is for Director Rausch. She asks, do you know if those hospitalized and the people who passed away recently were vaccinated? And is there any progress on the front of collating that data?
Yeah, that's a great question, Joyce. Simple answer is right now we only have anecdotal information, and most of our cases and most of our hospitalizations, and by saying most, the vast majority are unvaccinated. But I have noted, and I have reached out to the state, and the epidemiology intelligence team has asked the state to add those vaccination fields that we collect when we're doing case investigations to see specifically how many of the cases, hospitalizations, and deaths in recent weeks have been vaccinated. So we're hoping to get that data within the next week, and that will be added to the report.
Another question for this group, also from Joyce Garbasiak from WISN. She says, Racine County is offering creative vaccination incentives, including a chance to have utility bills and 1 month rent paid, as well as a chance to win smart TVs, iPads, and Chromebooks. Will we see similar incentives coming from Milwaukee County anytime soon?
So we've seen across the country all sorts of interesting large and small and everything in between incentives for vaccination. And we've seen in Milwaukee County quite a few of these implemented as well. But we'll look to Racine, we'll look to other communities, see what's working, and certainly consider those in Milwaukee County as well.
Dr. Weston, thank you. Our next question comes from Sarah with the Milwaukee Journal Sentinel, and she asks, This question actually is for Dr. Weston. DHS reports that in Milwaukee County, about 24% of Native Americans are vaccinated, but Milwaukee County's EMO reports about 49% of Native Americans are vaccinated. Can you explain the discrepancy in Native vaccination rates, and which of these is the better measure of Native American vaccination rates?
That's a great question. I'll have to take a look at our dashboard and get back to you offline.
Okay. Any additional questions from the media? We had a pretty quick briefing here. Anything else that we can get answered for you while you have our experts in front of you? All right, well, I guess that's it for now. Really appreciate all of you joining us on this lovely Thursday afternoon for our briefing. Catherine Foley will be back from vacation next week, so you'll see her face on Tuesday. Thanks, everyone. Have a great afternoon.
Thank you.
Thank you.
Thanks.